How does gender influence student learning, stress, and career choices in endodontics by Kichenin et al. In 2024? An European Commission reported on gender equality noted that gender stereotypes are an obstacle for both men and women. These stereotypes influence the family and individual choices such as education, training, and employment, which contributes to the persistence of inequalities. From the childhood, there remains a stereotype that females lack talent, a perception which is observed in almost all of the 72 participating countries in the Organization of Economic Cooperation and Development Programme for International Student Assessment in 2018. Despite similar intellectual abilities, females outperform males in written exams, and in exercises that require them to evaluate and improve on the ideas of the others. A study using the Learning and Study Strategy Inventory, the LASSE scale, among medical students demonstrated that women and men have different learning strategies. The women performed better than men in their attitude and interests and in using academic resources, while men had higher scores than the women in information processing and identifying the main ideas. There were no differences, however, for the concentration, motivation, and the time management. In dentistry, the same trend between both genders was also highlighted. A study using an acquisition encoding retrieval supports the ACRA scale showed a significant differences in some of the assist learning strategies, which females scoring higher in the domains of cognitive and learning control strategies and learning support strategies, while there was no differences in the other domains such as the study habits. So the aim in this study was to assess the influence of gender on learning, preparedness, confidence, and anxiety and stress on undergraduate dental students in endodontics worldwide. And the further aim was to assess if choosing endodontics as their postgraduate specialty by the undergraduate dental student was influenced by the gender. This narrative review was made by a preliminary search in May 2024, and the data search identified 35 articles coming from 16 countries, and the results were analyzed in 6 subsections. For the first, the influence of gender on the knowledge and preclinical and clinical psychomotor skills in endodontics. The dedicated knowledge by a Spanish study investigating the undergraduate dental students' knowledge of the indication of antibiotics and the management of endodontic infection highlighted that there was no significant difference between respondents in the relationship of a gender. From Saudi Arabia, demonstrated that female undergraduate students performed better in endodontics written knowledge tests and assessments with both traditional lectures and blending teaching methods compared with the male counterparts. However, there was not a significant difference between male and female students in the practical exams. So, although there is a limited volume of unavailable information that exhibits significant variation based on the current evidence, it seems that women tend to underestimate their knowledge and the psychomotor skills despite the achievement equalative or even better academic and practical and clinical results than their male colleagues. This observation underscores the importance of mentorship to promote the confidence, progress, and development of male and female undergraduate students in endodontics. For the influence of gender on the challenges and difficulties encountered in clinical endodontics, in order to improve the student learning, identifying challenges and difficulties as important. However, the influence of gender or managing the difficulties encountered during root canal treatment has not been extensively studied with the smaller number of existing investigation using mainly the BISCOPE and the non-validated questionnaires. So the results of the different studies highlighted no clear influence over the gender on the management of the challenges and difficulty in clinical endodontics. The influence of the gender over the stress and anxiety in endodontics. The stress is identified as a mental or emotional strain placed on or experienced by a person as a result of an adverse or demonstrated circumstances, especially by the pressure of the problem, by the Oxford English Dictionary. The influence of a gender on a student's stress and endodontics has not been extensively investigated. There is a strong consensus among the dental students that endodontics is the most stressful or one of the most stressful dental disciplines. For the anxiety, which is the different from the stress and can be defined as the worry over the future or about something with an uncertain outcome, uneasy concern about a person's situation, and a troubled state of mind arising. The anxiety have been investigated during emergency endodontic treatment, although the undergraduate females had a significantly higher mean score than the males, suggesting a higher anxiety in the general life. There was no statistical difference in the mean scores in relation to the gender of the participants, corresponding to no differences in the level of anxiety between males and females prior to the starting of the emergency endodontic treatment. So, depending on the study methodology, country, and the university of origin, a significant difference in the stress and anxiety in endodontics according to gender may or may not evident. If a difference was reported, men were less stressed and less anxious than the females. Gender influence on the endodontic specialty choice. A limited number of studies have analyzed the influence of gender on the undergraduate students, the future aspiration to choose a postgraduate specialty. And those studies were based on a questionnaire survey sent to the dental students. The overall, it appears that the gender influence regarding the interest in different dental specialties, the influence of a gender over a subject, choice varies according to the year of the graduation for the undergraduate student, and the dimensions in the final year students, and the afterwards when choosing the postgraduate areas of interest. The impact of the faculty mentoring, encouragement from significant others, and the family support on the postgraduate students seems critical. The endodontics is a specialty that appears to be more balanced by gender, in contrast to the oral surgery and oral maxillofacial surgery or prosthodontics, which are traditionally predominantly males, and also in pediatric dentistry. Especially the referring to the endodontist specialty chooses by the gender, the results vary with the females showing a greater interest than the male in some studies. So the aspiration for the postgraduate training and specialty among the undergraduate students have often been gender-based, and this is less evident in endodontics than in other areas such as oral surgery or even pediatric dentistry. So in a conclusion, with the limitation of this narrative review and the limited numbers of articles available, it would appear that female student underestimates their skills and knowledge more than the male counterparts in endodontics, despite generally the achieving equivalent or even the better results.